So yes, there are many new rights for individuals, and these are, with the omnibus ruling, we have to be very cognizant of what's happening here. A lot of these things have changed for you as a provider, and it's important that you know these items. The first thing is the patient can request a copy of their medical records in an electronic form. Now, it used to be that they would request information from you, and you could then print it off and say, here's your printed medical information. You can still charge for those copies. It's a minimal charge. Usually that's about 10 to 25 cents per copy. It's not something you're going to make a profit off of, but something that you can charge for that cost. But now, if the patient asks for those medical records in an electronic format, you have to then give them to the electronic format. So you have to give it to them in the format that they requested it. Next big ones, and this is a complicated one, but this is really quite important. If a patient pays in cash, and they pay fully in cash at the time, and asks the provider not to share treatment with the healthcare plan, the provider has to follow that request. Now, again, they have to pay fully in cash at the time. If they pay only partially, or they pay and it's a canceled check, then they lose that protection. This isn't as important these days, or it's interesting that this law was passed because with the Affordable Care Act, there is no underwriting of healthcare plans. So there's really not a reason to withhold information from a healthcare plan like there was before, because it used to be if you were diagnosed, say, with diabetes or cancer or something like that, and you wanted to keep that off your healthcare plan so you didn't have a pre-existing condition, then that would be a reason that a patient might keep that off their record. Some try to keep things off their records for things like STDs, just for embarrassment. But what it comes down to is if they pay fully in cash for a procedure and ask you not to file that with the healthcare plan, then you then have to honor that. Now, this does not include any mandatory reporting of infectious diseases. This includes any hemorrhagic fevers, anything that is required to be reported to the CDC. That would also be certain STDs. That includes things like Zika virus now. So those things still have to be reported. It doesn't matter what the patient wants to withhold at that point, because that is part of the common good. Any treatment, payment, and operation disclosures that you need to have. So that means if they are diagnosed with something, that does become part of the health record. It may not go to the healthcare provider, but again, it is part of the health record, so that you make sure that you're treating the person properly. If there are any payment issues, then you know that it can go. Then you are allowed to file that with the insurance company. And any operations disclosures that you need to make sure that things are running smoothly. Reporting or suspected abuse and neglect. This includes child abuse, spousal abuse, elder abuse, any of those things. You do have to report those to agencies. It doesn't matter what the patient requests. You have to, though you are required to report those. And also any workplace medical surveillance. Now, it is important to note that if you do have to release any information as far as workplace medical surveillance, you do need to give the written notification to the individual that you are disclosing that information. That is important to note. Also, there are two other items that you need to be careful of, is also disclosures, actually one other item is disclosures related to FDA products and activity. So if a patient is paying for something off the book, don't want to report it anywhere, but there are maybe some issues with medication that need to be, or the FDA is asking for census material on with that medication or that procedure, then you do have to report that also. So it's important to know those things. And there's also new limits on usability of patient data. So this prohibits any sale of information without permission. This is restrictions on marketing and fundraising purposes. So it's important to be very careful about what you're using that information for. And actually, Dan and I had a really interesting discussion right before this about, what's considered marketing and what's not considered marketing. And you have things where if you are dealing with treatment, saying you need to come back in for your physical, or say you are a pharmacist and you're distributing drugs, you can send drug notifications to the patient. Those are not considered marketing releases. That also, if you say you're a hospital and you have a new MRI clinic, or you have some new clinic or new doctor joining, that's a very general, that's not a direct marketing. Direct marketing would be, hey, you have some disease and we have a new treatment for it. and talking about that outside of an actual sitting in an appointment with the patients. I'd be sending that material to them. So it's you have to be very careful about that. Anytime you're doing any fundraising and doing any marketing, make sure you have signed disclosures before you start to do those. Last week we were talking about there was a group that was fined for putting up patient testimonials on their websites with names and identifying information. They were fined $50,000 for those violations. So you want to be very careful about what information you're putting up on websites, how you're marketing information, how you're marketing to your patients. And I'm going to pass back to Dan here. He's going to talk to us a little bit about the new Genetic Information Non-Discrimination Act provision that was added.